Well, Dr. Gottlieb, it's good to see you. You know Dr. Bright. You've told us you worked with him. Tell us what you think about this story tonight.
Well, look, I think that the complaint and the episode is unfortunate. What it's going to have the effect of, setting aside all the allegations in the complaint and the substance, the net effect is that companies that do need to be collaborating with BARDA right now are going to be more reluctant to do it, because this is going to cast a cloud over the organization. And they're going to be reluctant to embrace BARDA and try to seek resources from the organization. So at the very time that we need a fully functional BARDA, I think on the margin, this will make more companies that much more reluctant to engage that process.
Had you heard again about any of these allegations that Dr. Bright makes, that he tried to get the administration to scale up on supplies like N95 masks, but that he wasn't taken seriously?
These have circulated in the press for some time, at least some of them. I haven't heard them personally because I wasn't involved in the response to COVID. I had left the administration before that. But some of these had circulated previously. I don't know the veracity of the allegations. I know Rick Bright. I trusted him. He was a truthful, fellow to me. I worked closely with him when I was at FDA. I would take what Rick says seriously, but I don't know the substance of these individual complaints.
So if you were to tell us about Dr. Bright's character, you would say that he is a man of integrity?
He was a straight shooter. I mean, he was a straight arrow with me. We worked closely together. I testified alongside him when I was testifying before Congress, where we worked on an Ebola product together, Ebola vaccine. We worked on a smallpox therapeutic that we got over the finish line, that he helped fund, helped support. So we did some important work together, and I always found him to be pretty straight up.
Let's talk about another big story today. That is Pfizer, of course, beginning human trials for its vaccine. You are on the board of directors of Pfizer. Remove yourself from sitting on the board of directors for a moment and just tell us how significant this is and how optimistic you may be.
It's significant. It's a pretty robust phase 1, phase 2 study. The press release is available for people to scrutinize, and I tweeted it out today as well from my Twitter feed. But it's one of a number of projects that are underway, efforts underway by major manufacturers, U.S. manufacturers, to try to secure a vaccine and be able to manufacture it both domestically and abroad. Merck has a project underway. Johnson & Johnson has an advanced project underway. Pfizer has one underway. And then there's a number of foreign manufacturers as well, like Sanofi Aventis is working on a product as well, collaborating with GSK. So there's a number of robust, large efforts underway. It also includes a number of smaller manufacturers here in the United States, Moderna, Inovia. So we have a lot of efforts underway. And what's good about the efforts that we're undertaking is that they're diverse. They're all different approaches to trying to develop a coronavirus vaccine. Some of them rely on pretty old technology or old approaches, protein vaccines like what Sanofi's doing. Some of them rely on much more novel approaches like what Pfizer's doing or what Moderna's doing with an mRNA approach. J&J is taking an adenoviral vector vaccine approach, which is similar to what the Chinese are doing and what AstraZeneca is doing with their collaboration with Oxford. So that's a good thing that we have diverse efforts underway. They're all slightly different because one or more of these has to work, and hopefully multiple manufacturers work. We really need more than one U.S. pharmaceutical company to succeed at developing a vaccine if we're going to have enough to both supply the U.S. population as well as other countries.
News of the vaccine, of course, comes as there's another study out today, Dr. Gottlieb, from Los Alamos that suggests there's another strain of the virus that's become more dominant and even more contagious than the first. What do we know?
Well, I think we need to be careful interpreting that. It was a computational analysis looking at sequence strains and finding some differences between the different strains, basically a single amino acid chain change in the strain of the virus between two different strains that they observed. They haven't done any work to correlate that with actual clinical performance of the virus, whether or not it actually made the virus behave differently. We had a similar thing happen with Ebola in West Africa, where there was a mutation that caused a single amino acid change. And that was actually looked at in cell cultures. And in the cell cultures, it in fact demonstrated that it made the virus more contagious. But when it was put into animal studies, there was no difference shown. And this particular finding from Los Alamos, they haven't even experimented with the virus in cell cultures to demonstrate that this change would make the virus more virulent or more contagious in cell culture models of coronavirus, let alone testing it in animal studies or correlating it with outcomes in people. So we're a long way from concluding that this actually has an effect on how the virus behaves in humans.
Or perhaps a bit of a reality check. We thank you for that tonight. Let's talk about testing. Speaking of reality checks, today the president said, and I'm quoting here, "We have so much testing, I don't think you need that much testing." However, today on CNBC as well, Dr. Gottlieb, the CEO of Atlantic Health Systems, said, quote, "We're not anywhere near where we need to be." Do we need more tests?
We need more testing, for sure. And as we head into June, I think we're going to see a lot of capacity start to come onto the market in June and July and August. I think by the fall, we're going to have a lot of testing available. And the challenge isn't going to be the testing platforms, but the sites performing the tests. We need to make sure that doctors' offices and places of employment are willing to perform tests, that we can get these out into the community. But the shortage won't be the actual testing platforms. Right now, over the month of May, we still have a shortage of testing platforms. We'd like to be performing more tests. It's ramping very quickly. We're performing probably about 1.5 million tests a week right now. I think a good number to try to get to would be about 3 million. I think we'd really feel the difference if we were out at about 3 million in terms of more availability in the community and not just around hospitals. We'll get there towards the end of the month. We'll probably even get to 2 million mid-month, but we're not quite there yet. We still have a ways to grow.
Finally tonight, the White House plans to wind down the virus task force, it says, in the coming weeks. That's according to the New York Times. Good idea?
Well, I think that they need some kind of coordinating process inside the White House, and it's not really clear right now what's going to supplant this. I believe that there's going to be an increased emphasis on trying to bring coordination around the development of therapeutics and vaccines for COVID-19. And I wouldn't be surprised if you saw the White House stand up some kind of process similar to the task force, maybe some kind of working group that tries to bring together the agencies to focus on therapeutics. So as this pandemic evolves, the focus of the White House is going to evolve as well. And so I think they're going to be focused more on the therapeutics now. So I wouldn't expect the task force just to be wound down and nothing to be stood up in its place.